Welcome to the Rawbellion Conversations. Now, this is the ProDog podcast where we help you take a more natural approach to your dog's health and happiness. Now, in this episode, we'll be discussing what is a holistic vet and the difference between a holistic vet, homeopathic vet, and a conventional vet. Now, I'm Caroline Spencer, your host today and part of the ProDog team. But we've got a really special guest for you, and that is Dr. Nick Thompson, who you may well have heard about. He's a renowned holistic veterinarian and with extensive experience with natural and integrative approaches to pet healthcare, and a huge advocate, of course, for raw feeding. So, Nick, so kind of you to join me today. And thanks for your time, because you're a very, very busy bloke.
Caroline, it's great to be here. Thanks very much. It's great to see you again. We haven't seen each other for 10 years or so since we had lunch one fine afternoon in London.
Indeed.
It's great to be here. It's great to support ProDog. We love those guys. It's a family-run business, and they're doing a lot of really, really great work. So, absolute pleasure to be here.
Oh, thank you, Nick. Now, I know we're talking about, the differences between conventional, holistic and homeopathic vets, but can you just give a little soupçon of where you came from and why you do what you do now and what you do?
So where I came from, I was a conventionally trained vet, qualified from the Royal Dick School of Veterinary Studies in Edinburgh. In 92, I went into practice, conventional practice for about 7 years. Then I started my own business, which is holisticvet.co.uk. I started that in 1999, so we're 25 years this year, which is amazing. We do homeopathy, acupuncture, nutrition, and herbal medicine. But over the last 10 years or so, the raw food thing, especially canine raw food nutrition, has really grown enormously, and so it's kind of edged most of the other stuff out. Which I regret not seeing so many horses. I love working with horses, but something's got to give because there's only so many hours in the day. So doing mainly work with dogs and mainly nutritional work with dogs. So I'm really lucky because I just talk about food all day long, which is fabulous. I love it.
Oh, that's fantastic. And of course, you're off to the USA to do a grand tour of talks and things out there, aren't you?
We are going to San Diego first weekend in November and in October, and then off to Orlando, and really looking forward to that. This is Dr. Judy Morgan is doing a weekend conference, and there are still places left. So if anybody's interested, there are still places there, and that is the second weekend in October this year.
Fabulous. So yes, if they're flying over, especially, or they're on holiday,
well, they can fly over. There's also they can attend via. There are online places available as well, and there's a lot of great speakers there, so it should be a very educational, a lot of fun, a lot of interesting information coming out through that. That
was me sounding very old school then, forgetting that we do stuff online, and here we are doing stuff online.
Here we are doing stuff online. That's right. Yeah.
Oh dear. Anyway, get to the meaty stuff now. So just what are the differences? This is a huge subject, I know, Nick. It is quite difficult to sort of précis it, but what is the difference between conventional, holistic and homeopathic vet?
So conventional veterinary medicine is basically a kind of a pharmaceutical paradigm. There's surgical options as well, and there are diagnostic tools, but fundamentally the therapeutics involves pharmaceuticals. That would be the conventional approach. A homeopathic vet, if they're exclusively homeopathic, they will be using all sorts of conventional diagnostics, but their therapeutics will involve homeopathic medicines. And a holistic vet is somebody who is looking at the the range of causes of disease, and also using a range of therapeutics, so they'd be using homeopathy, acupuncture, nutrition, herbal medicine, chiropractic, behavioral medicine, and possibly even some pharmaceuticals. And so it's a much broader scope, essentially.
Right. Okay. So how would you choose a vet? What's best for your
Mm.
dog?
How would you choose a vet? So I think fundamentally you need a primary vet, yeah, in case of broken legs or bleeds or emergency
Yeah.
stuff. So you need a primary vet.
I,
And if everything's going well and the dog is well, hopefully they're eating raw food and they're having a minimum of routine pharmaceuticals. If everything's going well, then you don't need to move any further than your primary vet. Great. There's some fantastic vets up and down the country,
so that would be,
conventional
your
vets
conventional,
up and
yeah.
down the country. Yeah, that would be a conventional vet. If if you're running into problems, say there's a disease process, a chronic disease process that, for example, recurrent gut issues, recurrent skin issues, for example, that, or even a lameness issue that you just can't get on top of, that's usually when people try and look at other options, and that's where either homeopathic or acupuncture or a more holistic approach might be warranted. Yeah, if you're having to give either the same drugs again and again and again, or a different set of drugs again and again and again, or every time you come off those drugs, then the problem returns. Then uh, people are looking for something a little deeper, and that's when you'd start thinking about other methods of approach to a given disease process.
Right. So, how would you ask your conventional vet for a referral, or can you just go and email someone like you? But I suppose you need to know the backstory, don't you? So,
Sure. Okay. So let's say you've got a dog who's got recurrent gut problems. Okay. Um, if you go to your conventional vet and they fix it, then great. You don't need anybody else. If you don't want to go to the conventional vet because you don't want to go for a pharmaceutical approach to that, I think getting a diagnosis is a good idea. Why is the dog itching? Why is the dog having recurrent gut problems? Why is the dog having recurrent coughing problems? Whatever it might be, I think getting a diagnosis, and then you say to the vet either, "Thank you very much for getting diagnosis. I'd like to look at trying to get on top of this without pharmaceuticals," or maybe you try the pharmaceutical route and you're not making progress, or you try the pharmaceutical route and you're not making progress, then you go for a different approach. It's quite logical, really. If you try A, B, and C and it doesn't work, you've got to go for D, E, and F, and that can often involve a more holistic approach to disease.
yeah, because you're talking about gut issues, and we've got lots, sort of, itchy skin and everything else that goes with all that. Sometimes it's
Mm.
really difficult to get a really good diagnosis. Uh,
No, no.
you, oh dear, I must have floppy earlobes. My ear thing came out. Um, do you say, conventional vets can only go so far with diagnostics? Are there different diagnostics that you will use, or different ways that you would use to find out the root cause? Because that's really important, isn't it?
Yeah, I mean, wi- within conventional veterinary medicine, you've got blood tests, you've got X-rays, you've got ultrasounds, and those would be, you've got MRI, CT scans, and what have you. So there's quite a lot of options for getting a diagnosis. So if you do get a diagnosis, they will say, well, you've got, option A, B, and C, usually involving pharmaceuticals, and you can say, I want to go for those, give those a go. And if they work, great. And if they don't, then you move on. Or the vet will say, you've got options A, B, and C. And you'll go, ooh, I don't really like those options. And therefore you would jump the pharmaceutical stage and go straight into, let's look at other ways of treating disease. And what you can do is you can either ask your vet to refer you if they know of a holistic vet. Then they may be able to do that. But often they don't. And so the beauty these days is that we have Google, and so you can do a Google search for a holistic vet, or a natural vet, or acupuncture vet, homeopathic vet near you, and they can you can then go to the vet and say, I've spoken to Nick or Brendan or Vicky Simon. I think you had her on recently, and you ask to be referred to that alternative vet who will work hand in hand with your primary conventional vet.
Yeah, perfect. And do you always have to, with having had all the diagnostics and everything, so we know what's sort of going wrong, do you actually have to see
Yeah.
that person face to face, or can you actually do it online?
If I get a referral from the primary vet, either initiated by the client or initiated by the vet, then we don't necessarily need to see the patient. But say for it's a gut problem, the dog has got continual poor gut health, then I can't see inside the dog's gut any more than you can, and so I think it's very legitimate that you could speak to them over the phone. Yeah, some vets do Zoom. I prefer to do telephone work, and so you don't necessarily need to be close by to that holistic vet. If you've got an orthopedic problem where the dog is moving asymmetrically or has some kind of gait abnormality, then sometimes it's good to see them face to face, so that you can walk them up, you can have a feel of the joints and the quality of those joints, and see how they're actually moving. But and also with skin, sometimes it's good to be able to actually see the skin problem, but not necessarily. When people are referred to me, I will ask for a full history, including the lab results from the vet. I will ask for as much data as I can. I'll ask for a questionnaire from the client, and if there are things that I need to see, then photos are very useful, and videos are very useful, and so we can get an awful lot of information. I'm I'm based towards the south of England. Vicky is over in Somerset with Liscombe. Brendan's in Leeds. There aren't that many of us about, so often telephone work is very useful.
Yeah,
Actually.
I suppose you can do a nice telephone consultation. Then, if you really need to see someone, because I'm up in Northumberland, we don't have but
Miles from
yeah,
anywhere.
miles from anywhere. It's beautiful though.
In terms of holistic veterinary medicine, I mean, my father was from Sunderland, so I'm very I've got a lot of time for the northeast, and yeah, it's a great part of the world, and the people up there fabulous.
Yeah, no,
There's not a lot of alternative vets up there, unfortunately.
no, indeed. But lucky enough, fortunate enough, my little dog is fit, healthy 10-year-old. I've raw fed her since I got her when she was 12 months old, and
Yeah.
yeah, fit as a flea.
Good.
So
Continue, Carol.
yeah, and long may
Yeah.
that last, absolutely. But
Yeah.
I know you're only a phone call away, which is so lovely, because I feel that I'm quite isolated from sort of the kind of veterinary work that I would like to be with. Then it's lovely to be able to have people like you to talk to on the phone, to again, set some fears to one side, really helpful. So when it comes to length of consultations, because our conventional vets, their hands are really tied. You're lucky to get 10 minutes. But when you go and see, a holistic or homeopathic vet, how much,
Sure.
how long is a piece of string, I suppose, but how long generally would you put aside for a consultation?
Sure. So before I have my first consultation, well, even before the first consultation, what I'll often do, people will email and say, my dog is doing this, this, and this. Can you help? And so what I offer in my practice is a 15-minute free um, review of the case, just to see what's happening and is there any opportunity for us to help. So that's a free consultation. It's not a consultation, it's a free chat to find out where we are, where we might go, and if we both feel we want to move forward, then we would then book in. We get the notes and the lab reports from the vets. I send the questionnaire to the owner. They fill that in, send it to me, and I spend at least half an hour before the first consultation going through all that data. It's like cramming for
Yeah.
an exam. I cram for an exam every single day, in effect, but I quite enjoy it, actually. And so I do half an hour of this private work before we even get on the phone. And then the first consultation for me will last between about 45 minutes and an hour. And that will be the first consultation. Then I'll write up my notes. I'll send them to the vet and to the client. I think it's really important that the client is fully aware of what we're doing within the therapeutic process. And then I'll talk to them maybe 2 weeks, 4 weeks later for maybe a half-hour consultation. How are things going? What's improved? What's changed, and what have you? And then we'll do follow-ups of 20 or 30, and if it's very in-depth, maybe up to even 45 minutes. But 20 to 30 minutes is really common. I like to say that the best vet is the vet you don't need to talk to. So I'm not in the business of having people indefinitely coming back and back and back. I'd like to talk to you initially for that first hour, and then have however many follow-ups, as few as possible, so that we can make as significant and rapid progress as the case will allow. Okay, so I like to see things happening within the first few weeks, first few months, because then we really know where we're going, and that we are able to make some impacts with that dog.
Yeah, lovely. So with say if someone was to live close by your surgery and everything,
Yeah.
um, you're offering with a holistic approach a wide range of treatments and ideas to help
Yeah,
them move forward, and that it
yeah.
involves sometimes conventional medicine.
Very rarely, but yes, it can do. I will, if conventional medicine needs to be administered, I will often hand them back to their conventional vet and say it's worth trying X, Y, and Z. Or if, for example, they need a blood test, I'll say, all right, please go back to your vets, get the blood test, and next time we speak, we'll be able to get those bloods, or we'll get the blood the vet to take some blood for thyroid testing and do a lot of thyroid testing. We then send that off to Hemopet, Gene Dodd's laboratory in the USA. We send bloods off there. They come back within about 7 to 10 working days, and then on the next consultation, we'll go through those bloods. So it's a team. It's the owner, it's the vet, and it's me and the dog, and we're all working together. Or maybe we need an X-ray or an ultrasound or whatever it might be. It's a question of using the tools that any of those elements of the team can bring to the table.
Yeah,
Okay, so conventional vets, they're pretty happy because often I'll send them back and say we need to do this test or this test or this test, or I'll say to the vets, I'll say to the owner, have a chat with your vet about maybe trying this drug, I try and avoid it.
Yeah.
I think that the best drugs are the drugs that you don't have to use, and if we can wean dogs off drugs for their gut, for their skin, for any given disease process, if we can wean them off onto more natural methods, and ideally nothing at all, nothing but great food, maybe some supplements, then that's the ideal. Yeah, the normal dog does not need any drugs. The normal dog does not need a vet. They just get on with it, as your little 10-year
Yeah.
old
Yeah.
demonstrates.
Like, actually, she has been to the vet once. She had a nasty UTI, and I've had one of those, and it's definitely antibiotics for me.
Yeah, that it focuses the attention somewhat.
Yeah, yeah. But again, if people don't want to go down that route, you will have other options, I imagine. Anyway, so
Sure,
but again, yeah,
sure. I see. Yeah, if I'm using drugs, then I, in my heart, I feel like I've failed.
yeah,
Sometimes you have to, just for the welfare of the dog. At a push, we'll use an antibiotic, but I try and avoid it. Yeah, the conventional paradigm is you've got an infection. Why would you not use an antibiotic?
yeah,
My approach is, well, there's two or three things. Maybe we can enhance the immune system. Maybe we can look at reducing inflammation in other ways rather than just immediately going for a non-steroidal anti-inflammatory, the metacams of this world,
yeah,
the antibiotics of this world. There are, drugs, antibiotics have only been around since the 30s, 1930s. Non-steroidals, okay, aspirin was invented, discovered maybe 200 years ago. Modern non-steroidals only in the last 60, 80 years. What did we do before that? We used
exactly.
we used herbs. We've been using homeopathics for 200 years. The Chinese have been using acupuncture for 2,000 to 4,000 years. Osteopathy and chiropractic and these manipulative interventions, they've been around forever. Food has been around
Yeah,
since dogs have been around,
and
45 million years.
that's
So
right.
there's a, we turn our back on that ancient wisdom at our peril. Just because we've got drugs doesn't mean we need to use them, you know?
Yeah, yeah,
So yeah,
absolutely.
there's a lot of exciting therapeutics to look at out there before you are forced to go down a drug route in many cases.
Yeah, I suppose it's smashing down those barriers now and looking to what we did have, and bringing that back to the fore, and helping
Cool.
people and giving people far more choice rather than
Yeah,
just railroading them into this is the only way. I love to have choice.
yeah. I think it's really important to have choice. But if you go to the conventional vet and they're not familiar with any holistic therapeutics, then they're not going to be able to offer them. But we have the internet, and so there are all sorts of avenues that you can pursue, yeah, along with a holistic vet. So I think there's more choice now than there used to be, and I find vets are more or less um, okay with a referral to a holistic vet.
Yeah, yeah.
Yeah, in the old days, yeah, there was pulling of hair and gnashing of
Yes,
teeth whenever
absolutely.
a holistic referral was mentioned. But nowadays, they're pretty good. Yeah, and communications is really good. I send emails to vets always, and I think the profession has matured to think we are not a threat. We are just another part of the
Yeah.
team who doesn't operate from that given primary practice. Yeah, it's teamwork. We're all in this together. Vets are committed to the best welfare of dogs and cats and other animals under our care. And I think the veterinary profession is getting that more these days. So don't be scared to, for anybody watching, don't be scared to have a chat with your vet. They will usually be absolutely fine. They may need some guidance as to where you want to go, but that's okay. You
Yeah.
know, be proactive with the management of your dogs, your cats, your animals. Yeah, very much so.
Absolutely, it is your choice, and it's really good, I find, to go in with some knowledge to
Mhm.
your vet. It's like I have a lot of clients that phone me up. They've got a reactive dog. I always ask to go to your vet, get a vet check. I also ask them to go to gallon therapy or something like that to make sure that all the nuts and bolts and bodies are all in the right place. For a lot of these dogs have got sort of pain and what have you. But
Yeah,
so they're very open to that. Whereas when I was asking this 10, 15 years ago, eyeballs revolved. So yeah,
yeah, yeah,
it is very, very heartening that things are moving forward.
yeah.
Um, so can you get all this under insurance, Nick?
Yeah, usually I spend my, well, I don't, thank God. Ellie, my wife, and my practice manager spends, you know, hours every day filling in insurance forms. It's a pretty easy process. If your dog's had gut problems, skin problems, what have you, and you're coming to us or another holistic vet, then it's usually a continuation. So you will have paid your excess initially, and so this is a continuation. I'm a veterinary surgeon, and therefore it's just bringing in another veterinary surgeon within the veterinary team. So usually insurance is quite easy. We're doing digital. We're doing all our insurance digitally these days, so you don't have to post pieces of paper up and down the country. So it's usually pretty easy, and I find that that we rarely get any problems with insurance companies. Insurance companies quite like us because rather than a case needing expensive drugs, for months and months, years and years, which they don't really like because they have to shell out for
Right.
those.
Yes.
In many cases, we can remove or reduce the drug burden, and so they quite like us, I think, because in the long term, we can, in some cases, save some money
Yeah.
to the insurance company.
Yeah.
Yeah. So we rarely get problems
Yeah.
with insurance companies.
Oh, that's really heartwarming news for, I'm sure, many people, because some people have limits on their insurance as well, and some dogs who are on drugs for ever and a day, it
Yeah.
can be a great weight on
Yeah,
your
Mount.
shoulders. Yeah,
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 sure,
absolutely.
sure. Yeah, it does. And yeah, I mean, and you're paying out for your insurance. So if you are paying out for insurance and dog gets a long-term condition, that's when you use. It's like having breaking your windscreen and not claiming on insurance
Yeah,
for your car. You know, so chronic disease, or broken leg, but chronic disease is one of the prime reasons why people will use insurance because the costs can mount up every month.
yeah.
Yeah,
I'm
very
sure
much so.
if you've got a dog on long term drugs and stuff like that, then the insurance can go
Mm.
up as well. So if you pull
Yeah,
that up,
anything you can do to resolve as
solve it.
quickly and economically as possible, bearing in mind the welfare of the dog, then yeah,
It's gonna
that's what we're looking.
help your
We're
pocket
very much looking for a
immensely.
quick resolution. Yeah,
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 yeah.
where possible.
That's
Yeah.
fantastic. Nick, thank you so much. Is there anything else that, a question that would be burning for me to ask you that I haven't asked, or something that you'd like just as a
Uh,
tag at the end?
I I mean, apart from talk to a responsible raw food company and get the best raw food you possibly can. Go for diversity. Make sure you're getting your omega 3s. Make sure that you've got some nuts, herbs, and seeds, and if they're not in the diet already, that they're going in already, that you're getting out in the early morning lights to get that near infrared is very, very important. It's very anti-inflammatory. It's very good for promoting metabolic health. That's really, really important. And promoting health to keep away from vets.
Yeah.
I think is a really important message to get out there. But if your dog is sick, don't sit on it for months and years. Lift the phone. You can speak to me. I'm sure other vets may do something similar. You can speak to me for free for 15 minutes. We can make an assessment. And then if we feel that there is some room for us to move forward, then we can book in and get cracking with that case.
Yeah.
The earlier you get any pathology, then the easier it is in most cases to begin to undo that pathology.
Yeah, absolutely. Yes. Feed the soul and feed the body with really good food.
Yeah.
And that is the fundamentals of a long, healthy life, isn't it?
Yeah, definitely. Keep healthy, keep away from vets is always
Yeah.
always a good policy.
Fabulous. Nick, thank you so much for your time. It's an absolute pleasure talking to you as always. And hope we have a chance to speak again soon.
Yeah, Caroline, thanks a lot. Keep up the good work. This series of interviews, I'm sure, will be really helpful to lots of people. So well done you, well done ProDog for
Yeah.
promoting this education. It's what it's all about. Knowledge is power. So you're doing some great work. Thank you very much.
Oh, thank you. That's very kind. Righty ho. Goodbye for now.
See you. Thank you.